Hello, everyone. Good evening, everybody. I'm Priyanjali from Bladder Wellness team. I'm sure all of you must be keeping good health. Today, we have with us the very renowned Dr. Ashutosh Kumar from Dwarka, New Delhi, who will be discussing with us on a very important subject, which is kidney stone formation. Dr. Ashutosh Kumar is an associate consultant at Venkateshwar Hospital in Dwarka. His expertise lies in urology, uro-oncology, renal stone management, and renal transplant. Dr. Ashutosh Kumar has rich experience in this field of renal calculi and carries out the diagnosis and treatments with utmost precision and efficiency, ensuring that the patient health is in safe hands. Over to you, doctor. Let us understand about kidney stone formation today from you. And the first question for you would be, what are kidney stones?
Hi, good evening, everyone. Good evening to all your viewers. Coming to your question, what are kidney stones? So, kidney stones are basically crystalline solid structures which are formed in the kidneys. They are basically composed of minerals and salts, and when they accumulate in the kidney, they form a solid structure. So, they can be present in kidney or other structures like the structures in kidney, along with the kidney, is the ureter or the bladder or the urethra. All these passages can have a stone which are solid structures, mineral based structures basically. Yeah.
Right. So, doctor, what are the basic symptoms of kidney stone? Like the major issue lies in understanding that he or she has kidney stones. So, how does the initial stage look like?
So basically, a kidney stone patient usually present to us with pain. Now, the pain usually originates in the back side, in the lower part of the abdomen, upper portion of the abdomen, in the back region. The pain usually starts. Pain are generally very severe in intensity, and these pain usually radiate to a lower part of abdomen, sometimes in the medial part of the thigh also. These
Hmm.
pain can sometimes be associated with blood in urine. Other than that, there can be associated vomiting, associated nausea will be there. Patient can have swelling in the facial region, swelling in the feet. These symptoms can be there, but the most common presentation usually is pain.
Right. And what can be the causes of these kidney stones occurring?
So these kidney stones are multifactorial. Most importantly, in our scenario in these part of country, dehydration is the most common cause. Like in the middle
Hmm.
age group where people are in the working condition, they drink less amount of water, the liquid intake is less. In those conditions, dehydration itself is the major pathological cause. But apart from that, there are other causes also associated, like the dietary factor, the dietary habit of the people. They are generally associated with formation of kidney stones. Diet which are rich in oxalate components like spinach, brinjal, or diet which are rich in nuts, cashews, some salt intake. These are all associated with kidney stones. Especially in our setup, we see excessive salt intake. These salt intakes usually dispose to formation of kidney stones. Uh, in apart from that, there are other diet factors like taking a high proteinaceous diet like meat-rich food, excessive pulses. These are also predisposes to formation of stones.
Right. Doctor, you mentioned water initially. So, what is the correct way of having water? How much water to intake for a normal individual and how to intake that?
So water intake basically it depends on the location where you are residing. Like in our part of the country, there's so much heat and dehydration. The factor which determines adequate water intake is the amount of urine you are forming. So we generally
Hmm.
advise people that you should have an adequate amount of urine, something like 2 to 3 liters of urine output should be there. So that can correspond to somewhere like 3 to 3.5 liters of water intake. That could be a better way of taking water in present environmental conditions.
Right, right. And also, we have seen a lot of people in taking that much of water at once. Maybe they take a liter of water at once. So, what is the correct way of having water?
See, when you take a lot of water at a single go, everything will
Hmm.
drain or filter out in the same time. So we don't advise in the same this manner. We generally advise that this 3 liter or 3.5 liter water what you are taking has to be taken throughout the day in a proper proportions. Like
Hmm.
take 500 to 2 glass of water every 3 to 4 hours will suffice that, and you can have a proper 3 and 3.5 liters of water in the whole daytime. Better to avoid so much water in the night time because you have to wake again and again in the night time. So we restrict water intake till the evening period.
Right. So, doctor, coming back to the same point once again, do kidney stones form in one or can it form in both the kidneys?
It can form in both the kidneys. Generally, when kidney stones form in one kidney, there's a predisposition of formation in the other kidney also, because these kidney stone formations are basically metabolic related. So, when metabolism is associated with any disease pathology, it can affect both the organs simultaneously. Also, apart from both kidneys, there can be a formation of stones in the ureter. That the stones from the kidney can go in the ureter. So there are two ureters. Ureters are the tube which basically connects kidney to the bladder. So in these two ureters also there can be form a stone. Bladder can also have a stone which can come from either kidney, or there can be a new formation stone in the bladder itself. So all these organs can have stones.
Right, right. Well, moving ahead to the next question, doctor, what can be the preventive measures which one can take in order to, save themselves from having kidney stones?
So the most important preventive step you can take is to drink adequate amount of water. Water intake is the primary focus which we have. Apart from that, the second thing which is more important is to restrict your salt intake. Now, when we take a large amount of salt in our diet, the sodium content in the salt predisposes formation of calcium stones. The kidney filters out sodium and they keep the calcium within itself, and these calcium accumulate inside and form a stone. So we should restrict our salt intake. Apart from that, the dietary habit which I have told you previously is to reduce oxalate rich diet, because calcium metabolizes and combines with oxalate and it results in formation of calcium oxalate stone, which is the most common stone we have. So oxalate rich food like we have spinach, we have cabbage, we have like tomatoes, brinjals, or nuts, cashews, chocolates. These all oxalate rich foods has to be reduced in our diet. It doesn't mean that we have to completely avoid these diets. We have to restrict it to a certain way that we don't have a stone formation. Many people who are like having a recurrent stones in them, they do have a habit of taking these things in a larger amount. So in those patients, we generally advise to take these auxiliary food in a lower quantity. Then, if you are a recurrent stone former, we generally advise to take less amount of animal meat, because they have uric acid in them, and these uric acid predispose to uric acid stone formation. Some patients have a metabolic condition, so in those patients, we advise to get the metabolic condition treated for betterment of the for non-recurrence of the stones.
Right. Doctor, because we are talking about food here and the elements of food, what about protein? Can excessive amount of protein intake also lead to kidney stones?
Yes, that is what I'm trying to explain. That the end product of protein metabolism is uric acid. Now, if we take a large amount of protein in our diet, eventually it breaks down to uric acid. And if our body is not excreting uric acid in a proportionate amount, if there's excessive accumulation of this uric acid, they may result in formation of uric acid stones. So we have to have this restricted. But most of the people generally who are not a stone formers, in those patients they can like take meat or meat products in a higher quantity. But if you are a recurrent
Hmm.
stone former, in those patients we advise to restrict the protein or the meat intake. Pulses are also a source of pulses, like legumes and all, they also causes formation of stones. So that has also to be restricted in patients who are like having a stone formation in recurrence.
Right. Doctor, also we know that may it be any sort of disease or condition anyone has, delaying the condition or disease can lead to a lot of problems. Mostly the problems arises only when the patient is delaying it. So here talking about the delaying of kidney stones, how worst can it get, and what are the current treatment options available for the patients if they want to know that?
See, if a patient is having small stones like a 5 or 6 millimeter stone, we generally don't advise it to be treated surgically. These stones, like 5
Hmm.
6 mm stones, can pass out through the urinary system. We generally advise to take lots of water in them. They take water, these gets filtered out through the body. But if a stone size is more than 10 millimeter, in those patients, or if the patient is having recurrent episodes of pain, if the patient is having uh, symptoms of infection in them, then we advise patients to get this treated. So delaying is not advised. If you have to, like, if you are suspected of having a stone, get yourself evaluated. After evaluation, if stone is found to be small in size, then we advise a 6 monthly ultrasound, but you have to keep in follow up with the doctor. But if a stone is large in size, they can cause obstruction in the kidney. Now, what is this obstruction? When a stone is in the kidney or in the ureter, they may obstruct the passage of urine. And now that stagnant urine, which is not going out of the kidney, can become a nidus for infection. Patient may land up in septicemia. There can be a pyelonephritis infection of the kidney can be there. And in those conditions, patient may land up in sepsis and in ICU also. We have seen a patient landing up in ICU. So if a stone is obstructing and causing all these infection, raised TLC counts and other fevers and all, then you have to get it treated. Now there are variable, like your second question is how to get it treated. So there are multiple
Right.
methods. If a stone is small in size, we advise medical management for that. If a stone is stuck, if a stone is like 4 or 5 millimeter in size and stuck in the ureter, we advise medical expulsive therapy for that. But if stone is larger in size and it is stuck, that is not coming out, we have to intervene. Now, at present, in the newer generation technology which we are having, there are, most of the surgeries are endoscopic based. So, what endoscopic surgeries we are providing is we enter the body through natural orifices, like in the urinary natural urinary passage. We go to the stone and we break the stone with a laser, and through that the stone is cleared out from the body. Other process is a lithotripsy process, in which it is non-surgical process. The sound waves or the wave radiation helps in breaking the stone. It's lithotripsy basically, in which there is no surgical thing is being done over there. The stone is broken by the shock waves.
Right. Uh, so are these process painful somehow for the patients?
See, any procedure you are going through has some painful impact on them. But what I'm trying to say is these procedures, since it has become so endoscopic based, the procedure is very short duration. The patient has to be stay only for a day or two, and they get discharged. They can continue their work after a day or two, and the pain usually subsided by the evening of the procedure. So it's not much painful. Previously, what we used to have is a major surgery for these stones. But with the advent of these endoscopic things, we have achieved a good clearance and good results without much of pain and burden to a patient.
Right. Doctor, we also know that with our diet, having a healthy lifestyle is also very much important. So, how important is physical exercise in case of kidney stones? Is it important? And also, right after the operation, do we also suggest the patients to continue with the exercise? Is it safe?
See, physical exercise do have a positive impact on overall health of the patient, but there is no associated link with formation of stone. And we don't generally advise any specific kind of exercise to a patient who has a kidney stone. Sometimes secondary thing can also happen, like a stone which is in the kidney. When you are having exercise, jumping and all, that stone can dislodge from the kidney and can come in the ureter and make cause obstruction of the ureter also. So there's a secondary part, but overall exercise has no basic relation with stone formations.
Right. Uh, Also, Doctor, belonging from an Indian society, we always trust our home remedies or what we call Gharilu Nuske. So, is there any Gharilu Nuske for kidney stones as well? Because I personally have heard from the place where I belong, a lot of people they trust some leaves, maybe कुछ पत्ते का रस ये पी लीजिए, सुबह उठ के खाली पेट ये खा लीजिए, सारा stone wash out होके निकल जाएगा. So, what do you suggest your patients? Is it safe?
If a small stone is there, it has to eventually
Hmm.
come out. Now, people are trying different things, but the stone has expelled by itself only. So I don't usually, I'm practicing allopathy, and I don't, in our literature we don't find any of these gharelu nuskha to be applied in the
Right.
like treatment of stones. Uh, Water intake, what we can have is a good amount of water intake, which will help it out. But apart from there, that if you are having a stone which is large in size, you have to get it removed only. That is the basic.
Doctor, speaking about diabetic patients, what is the scenario with them? How do we treat them, and how cautious do they have to be?
Yes, it's a very good question. In diabetic patients, they are very much predisposed to infections. Now, in a normal patient, if a stone is there, it generally stays inside. And what we advise is to, if a stone is small in size, we advise them you can wait for some time. It can eventually pass out. If a stone is large in size, we generally advise for a surgery to them. They take their time. But in diabetic patient, what happens is if the stone is obstructing your kidney, it's like not allowing your urine to pass out. Infections flares up in them, and they can land up in severe infection called emphysematous pyelonephritis, in which the whole kidney can land up in a very devastating state. So a patient who is diabetic should be very cautious for kidney stones. If they found that there is a pain in the CT, they have found a stone, they should take care of that. They should get it like removed, because these infections can flare up very easily in diabetic patients.
And does it also take time, a lot of time for them to, get out of the, I mean, to
Yeah,
get cured?
eventually. Yeah, eventually, if they present in an early stage when there is no infection setting up, we can deal with this in a better way. But in case this infection set up, then we have to drain that kidney. We have to like put a stent in them. The drainage of the pus and all is required. So then eventually it will take some time. Many of the patient lands up in getting the kidney removed also. That stone, a simple stone, may lead in such a condition that kidney needs to get removed. So that is a devastating part of this.
Right. Also, doctor, time has changed drastically, and everything around has changed. Speaking about kidney stones, we have never heard young kids having kidney stones. But again, as said, time has changed. Why has this change come so drastically? Like, how can children, such young children, have kidney stones? What can be the reason behind it?
See, eventually, in our setup, I have operated a patient which is like 1.5 year old, and also operated a patient who is a 83-year-old. So, although kidney stone, we say that is a disease of a middle-aged patient, but we have extremes also.
Mm,
Now, why are we having extremes? In young kids, there are many metabolic conditions like cystinuria, alkaptonuria. They all may result in formation of stones like cystine stones, two-white stones, and all. So these metabolic condition is one of the cause of causing kidney stones in young children. Apart from that, toddlers or the school-going children, they generally don't drink a lot of water. So the water intake in children are very less, and that can be a cause in them. Apart from metabolic condition, in food habit also in these children, excessive salt intake, chips, kurkure, all these things have excessive salt in them. So these also predisposes to kidney stones in young children.
right. Doctor, there are also a lot of myths circulating kidney stones. Like we have heard people saying कि uh, daily beer पीजिए तो kidney stone निकल जाएगा. How true is that? Have you heard your patients saying it ever to you? And what do you suggest?
Yes, we have heard from many people suggesting that you take beer and the kidney stone will flush out. But eventually, the only motive is to hydrate your kidney. So, a 1 liter of beer or a 1 liter of plain water will have the same impact on the kidney stone, whatever you like. And the thing what changes is drinking 1 liter of water is difficult for people. Drinking 1 liter of beer
Hmm,
in like 10 minutes is very easy for them. So
right.
that can be a possibility, but going by literature, there is no specific role of beer in removal of these stones. Okay.
Right, right, right. Now, Doctor, as I can see, few of our viewers want to ask a few questions. The first question
Sure.
comes from Abhishek, who asks, "How does hydration affect kidney stone formation?"
So a good hydration level Well, see, the stone formation always depends on solute solubility complex. So if you have a large amount of solute in the body, these minerals, these salts, if these are in high concentration, they can accumulate in the kidney and form stone. If you keep your hydration level high, if the water content in the body is high, these stones don't crystallizes. These salts don't crystallizes, and they eventually in the ionic state they pass out of the body. But if the hydration level is less, if you are not drinking sufficient amount of water, the concentration of these solutes increases and they form crystals inside the kidney. So that is how it is all implicated.
Right, right. Also, doctor, we know that like any disease can lead to some other disease in our body. It is possible. So, with about kidney stones, if we talk about kidney stones, can it, trigger any other disease or any other organ of our body?
So kidney stones eventually can lead to failure of the kidney itself when kidney stones gets obstructed or get impacted in a particular place and not allowing urine to pass out. Eventually, over a period like 2 to 3 years of time, the kidney stone can result in failure of these kidneys also. Apart from that, kidney stone can cause hematuria. The stones can also cause infection in the kidney. The infection etiology is pyelonephritis, which can happen in the kidney itself. These stones can also cause, like in bladder itself, when the stone is there for a large amount of time, it can lead to malignancy in the bladder also. So there are multiple things which can happen in kidneys and bladder with the stones.
Right. Well, the next question, doctor, comes from Sumit, who asks, is intake of milk products, does intake of milk products lead to calcium stones?
No. So calcium stones are usually formed when you have large amount of calcium, which is not required by the body. Milk products, what we have, is generally helpful in maintaining the proper metabolism of the bones. So milk and milk products don't usually lead to formation of kidney stones, and calcium stones usually form when it combines with oxalates, which is present in the diet. So I don't think the excessive intake of milk product will result in any formation of calcium stones in them. Okay.
Right. Also, doctor, let us know if kidney stones can be transferred genetically. Is it possible?
Not genetically, but familial. Yes, there are certain metabolic conditions like cystinuria, which can result in formation of kidney stones in young children. But genetically, we don't transmit any gene for formation of kidney stones.
Right. Well, we have talked about the reoccurrence of kidney stones, and people are definitely worried about that. They have to be a little cautious. All the patients, all the kidney patients, we always say, um, doctor, what can they do to prevent themselves from the reoccurrence apart from having water?
So, first thing is when you have a stone previously, after surgery, we generally provide the stone to patients. So, what you can do is get your stone analyzed. So, stone analysis is the thing in which you get a proper composition of what stone is there. And apart from that, there's another test we call is as 24-hour urinary test. In these tests, we get to determine what is the excessive amount of salt concentration in your urine. So,
Hmm.
according to that, our treatment helps. Like if a patient is having excessive oxalate in the diet, we advise a dietary advice related to oxalates. Apart from that, there's a thing called citrate. We advise a citralka syrup or calcium, sodium magnesium citrate. These citrates are basically inhibitors of stone formers. So we advise the patients who have the recurrent stone former for 3 to 6 months of citrate consumption. We advise them to take citrate syrup daily for like 3 to 6 months, and they help in prevention or recurrence of stones in them. We also advise some stones are infective in etiology, so we generally advise to keep a check in the urinary stream and all, so that there should not be any recurrent infection in the urinary system, which can also result in recurrence of stones. Dietary habits we have
Right.
discussed so far, so that has to be
Yes.
taken in consideration because that is the most important aspect for stone formation.
Right. Well, before we end today's live, doctor, any take-home messages or message for our viewers who has watched us so far?
So don't you? The message which I'm trying to give is, over all these discussion, the water intake has to be a priority. You have to keep a bottle by your side. Keep drinking more and more water. If you are a recurrent stone former, then keep your diet in the fashion that you don't form again and stone again and again. And if there is a symptom of stone, go to urologist, get it evaluated, get it treated, rather than losing a kidney, because we have seen many patients who lose their kidney just because of the presence of a small stone. So we advise go to a urologist and get it treated.
Right, right. Well, that was Dr. Ashutosh Kumar for us. Thank you so much, Doctor, for your valuable time. It was quite an informative session for our viewers today, and we look forward to many more such sessions in coming time. Also, thank you, viewers, for your excellent participation. For more information updates, stay connected on our FB page, Bladder Wellness. We are also available on YouTube, Twitter, and Instagram. Thank you. Stay safe and stay healthy.
Thank you so much.